The other venue for Facebook or other social media pathways is for the patient community to communicate with the patient community. And this is what I think is very, very powerful. Now, I personally am not on those Facebook pages because I feel like the patient community needs to have some privacy to communicate amongst themselves. But once the patients are able to communicate with other patients and families that have had similar things, they get to connect in a way where the medical community now is excluded. So we don't run the risk of violating any sort of HIPAA regulations or confidentiality issues. These are simply patients communicating with other patients and families to learn about what their experience is like when they were in the hospital, what the consultation was like, what was Rochester like, what was Mayo like, what was, wherever they've gone to visit. And so it's a way for them to communicate between themselves and learn what the experience was like through the eyes of another patient and their family. And this also really is helpful by the time they get to me. It absolutely has made me a better doctor and a better surgeon, because as much as myself and my secretary and the whole medical team makes a concerted effort to be sort of dialed in to the concerns of the patient and the family, to be sensitive and sympathetic to their concerns, there are still things that come up where I was like, wow, I didn't realize that that is something that really could be on your mind. And so it's been enormously helpful in terms of making the whole medical team a better medical team. And I think it also has been much more helpful to the patients, because they really learn what the questions are that need to be asked, because they're learning through other patients that have had experiences. The outcome with most of the procedures that we do right now has gotten to almost an all-time low with regard to risk. And now it's about making the experience positive and favorable. It's what the rooms are like in the ICU. Can mom and dad be there? Can they be there 24/7? Can they be there when procedures and interventions are being done? Having the social worker involved, the pharmacist. I mean, now when we make group rounds, team rounds includes the family. I mean, they're part of the team in terms of making sure that things are communicated, their concerns are addressed. And so anything that we can do to make the overall experience and the outcome more positive and more favorable, we are on board with. And I think that Facebook and social media and the ability to optimize all this communication before, during, and after surgery has really optimized that actually happening.